Hey everybody, it's Chris Pumill, and on today's episode of Whiteboard Wednesday, we're talking about echocardiograms. So an echocardiogram is an ultrasound of the heart. There are a few components of an echocardiogram study. We look at the heart function and structure. So this will be helpful to see if the heart's squeezing appropriately, has good function, if it's not squeezing as strong. The other components we start to see are valvular assessment. Valvular assessment looks into the specific valves. So there's 4 valves in the heart. You have your aortic, you have your pulmonic, you have your mitral and tricuspid valves. All of them can become either regurgitant or leaky, meaning blood goes backwards, or stenotic, or tighter when it opens, meaning it's harder for blood to go out through into the next chamber. So each one is interrogated closely and assessed to see if they leak or are stenotic. Just as you're looking at systolic function or how well the heart squeezes, you also look at how well the heart relaxes. The heart doesn't only squeeze. So when it's not squeezing, it's filling. So when the heart takes time to fill, you look at the amount of pressure in the heart when it fills. This is actually a more common cause of heart failure or weaker heart, or essentially backup of fluid in the heart, than systolic heart function. So we use certain assessments to look at how well the heart moves backwards or relaxes, and we calculate the pressure in the heart to give you a good assessment. An echocardiogram, in summary, is an ultrasound test that uses both visual and Doppler or sound assessment of the heart to be able to see how the valves look, how the heart squeezes, how it relaxes. There are a few other intricacies that we do from time to time based on the clinical setting. So if we need to use 3-dimensional imaging, or if we used to use different types of M-mode or more time-specific imaging. With regards to what the patient should expect, it's not an invasive procedure. It usually includes an ultrasound machine, which essentially is just a probe where the sound comes out of, that gets put on the chest, and then we use conductive jelly that allows the sound to be pushed from the actual probe to the heart. So aside from a little bit of gel, there's no needles, there's nothing painful, a little bit of pressure on the site from when we need to push, but very well tolerated. You can eat whatever you want before, you don't have to expect, you can take all your medicines. Non-invasive, safe test, there's no radiation, there's no contrast. So we do it in everybody, pregnant women up to elderly, and no one has any complications from it. So I hope this helps.